screen and you want to minimize the live feed, just use that grab bar to make it smaller and the screen be larger. Links to the recording of the webinar and slides of today's presentation will be available within a few days of the session in Everbridge University. We'll send you an email as soon as they're posted. And before we begin, I just want to remind everyone that this is an interactive session, so we're going to have several polling questions along the way. So keep those fingers on the mouse button. And at the end of the webinar, we'll also have a link to our CMS compliance survey and feedback form where you can request an account manager contact you. Now, I'd like to introduce you to our speaker, Alex Margolis. Many of you have had the pleasure of working with Alex in the past. And for those who haven't, let me give you a little bit of background. Alex has a BS in biology and a minor in philosophy from Brandeis University. He spent several years working in research labs before making the leap to healthcare software with EHR giant Meditech. So Alex is very keen on process. We are proud to have Alex and his healthcare expertise on our Everbridge implementation team. When he's not implementing, Alex has been known to flex his muscles by building homes with Habitat for Humanity or playing Ultimate Frisbee. And now with the formalities out of the way, I'd like to turn it over to Alex. Take it away.
Great, thank you very much. Hi, everyone. As Meg said, my name is Alex Margolis. I am an implementation specialist here at Everbridge, and I'm going to be walking you guys through the emergency preparedness gap analysis. So today what we're going to be covering is a number of gaps from the new CMS Emergency Preparedness Rule, and then a number of ways that we can use our Everbridge suite products in order to fill those gaps. So we're just going to jump right in here, talking about some of those gaps. And we're going to start off with our first polling question.
So our first question is, do your emergency plans address the 6 areas targeted by the new CMS Emergency Preparedness Guidelines? There should be a poll on your screen, and you should be able to select your vote now. Okay, looks like the results are coming in, and we're almost evenly split between epidemic, pandemic, and natural incidents. I'm going to give folks a few more moments to get their answers in. Okay, I'm going to go ahead and close out this particular poll. And let's go ahead and take a look at the official results from that poll. So it looks like we have 54% have selected epidemics, pandemic, and 46% with natural incidents. We didn't have any takers for the other 3.
Thank you very much, everyone, for voting in that poll there. It's very interesting to see the results like that. It looks like there were a number of those templates that we weren't actually using, which is good to know because one of the requirements within CMS is that we do actually have to go through and make it so that we are able to send off notifications extremely quickly. And frankly, we have to be able to do that for not only the natural disasters that I believe 46% of you have already planned for, but for the man-made disasters as well. So things along those lines of the chemical disasters and biological disasters, things like that. And not only that, but we also have to be able to send these messages to not only our staff, but also to the contractors of the hospital as well. And so frankly, you guys are actually already able to do this with Everbridge. So all of you guys will have access to our main notification sending product of mass notification. And you can use the templates there or the templates through our incident management system to preload all of those templates ahead of time. The idea is you'll be able to minimize the actual time it takes in order to send out those broadcasts during an emergency. So what we're going to do is actually jump into the system here, and we're going to take a look at that. So this system here that we're looking at is an internal Everbridge demonstration organization. We call it Everbridge General Hospital. And so what we're going to do is first talk about our notification templates. So we'll go with notifications, and then click notification templates. As you can see, we already have a template built here. So let's pretend this is an active shooter. So if the template is built, with all the information ready to go, the location, everything like that, we can just check this box here and push send, and this message will be off and running. We also could edit this template before sending it by clicking on this little pencil icon here. As you can see, we have our message already set. The only thing is, it doesn't specify anything about the location, right? We just have this open space and set braces. So we can actually highlight it, manually edit this particular template here. Perhaps, the shooter is the ambulance entrance, so that's what we want to notify people about. Everything else is already set and ready to go. We have our contacts, we have our settings. So all you have to do is come down here to send and save, choose to send this now, and push send, and this message is off and running. As you can see from the notification side, very, very simple. From the incident side, it's going to look a little bit different. So you see that we have a lot of templates that are already built into the Everbridge system. These templates are going to be part of a CMS template bundle that we do have available for you guys. If you're interested in learning more about these, please reach out to your account manager. For now, what we can do is go and do launch incident, and come down here and choose that same active shooter template. So as you can see, all we have to do is just fill out a form. In this case, all we have to do is just choose the location. So we'll scroll through our list of pre-built variables that we can pull in here. We'll choose our ambulance entrance and click next. When we do this, you'll see that the term ambulance entrance populates into the message already. Everything else is going to be preset for us. Everything from the rest of the message, the contacts, the settings. And all we do is click send, and now this message is off and running as well. So, as you can see, it's very easy for us to pre-build our templates ahead of time in order to make the actual launching process substantially more efficient. Now what we're going to do is actually jump to our next polling question as well.
Okay, so for our next polling question, do you have a way to reach all staff and contractors? It must be both during an incident. So based on your current configuration, pick one of the following. You can do some staff, all staff, staff and contractors, or not. I'll give you a few moments to get in there and get voting. Thus far, results are good. Very few people have selected the none. So I'm going to go ahead and give this poll just another moment before I close it out. Looks like everyone has voted. And so what we have now on this poll is, looks like it's 22% with some staff, 44% all staff. Only 31% of our folks can reach staff and contractors, and 3% none. Take it away, Al.
So, it's good to see that there are so many of you who can already reach out to both your staff and your contractors as well, as that is one of the CMS guidelines we just talked about before. And not only that, but we actually have to have a way to communicate with those key people during an emergency. So these can be key people, for example, particular response teams, code teams, maybe people in particular departments, whatever it is that you guys need to do in order to choose the proper audience for your broadcasts. So we actually have a couple ways that we can handle this in the Everbridge system as well. First thing is with our rules. The idea of the rules is we can take some data that we have in our HR system, things like certifications, departments, locations, job titles, job classes, things along those lines. If it's stored in the HR system, we can upload it into Everbridge and then run filtered searches based off of that information in order to target the proper message recipients. So what I want to do is jump into the system and show you guys how this works. So if we come over to our Contacts tab, we can click on Rules, and you'll see that we already have some rules built into the system. These rules here are being targeted to focus on a couple of those additional information fields that we've already built in here. So for example, if we take a look at ED, we can see that it's looking for a custom field called department, starts with emergency. So anyone whose department field in the HR system starts with emergency will receive a broadcast using this rule. The thing is, it's not like we have to search off if there's one of those either. We can use more than one. So if we come into the NICU nurses rule here up on top, you'll see that, yes, it's searching for a department, again, department being NICU this time, but is looking for a certification of RN as well. So it's looking for all contacts whose certifications contain RN and department starts with NICU. Now this isn't going to work for all the audience that you need to select. There will be times you have to basically create a static group as well, and you can use our groups functionality to do that. The idea of the groups is that they're going to be very useful for selecting sets of people who are not going to be stored in any kind of HR system. So things like our code teams, our response teams, boards of directors, things along those lines will be best utilized as static groups that will be manually controlled. Again, we're going to jump back into the system here and take a look at that. So we'll come over to contacts and go to groups. As you can see, we already have a lot of groups already built into the system for you, or for you guys to look at in this case. So if we take a look at this group here, the leadership directors group, you'll see that this group is populated already with all of the leaders from this particular hospital. It's very easy to come in and add people as necessary. All you have to do is click Add Contact and add existing contacts to groups. Then you'll be able to see a list of all of the contacts in your organization who are not part of that group, so you can add them in as necessary. You can also remove people right here from the interface as well. So just remember, we do need to select our audiences properly for the message that we send out, and you're able to use the rules and groups in order to do that. We're going to transition again over to our next polling question.
Hey everyone, do you have multiple pathways to contact staff and contractors if the first pathway fails? Easy question, yes or no? Give you a few moments to get your vote in. So I'm very excited with the results so far because most people are saying yes. We do have some that are saying no. Just give it another moment before I go ahead and close out this particular poll. And if you want to go ahead and take a look at the results here, we have 81% have said yes, that they do have multiple pathways. So we do have 19% that are not using multiple pathways in order to reach their contacts.
And that's really good because, not only is it a CMS guideline in order to have multiple pathways in order to refer your contacts there, but it's also an Everbridge best practice as well. I know that during our implementations here, we always stress that you guys have as many delivery paths as you can for your contacts. Really use the full multimodal capabilities of the Everbridge system. As you always like to say here, an overhead page just doesn't cut it anymore. So you need to make sure that we have things like cell phone numbers for texting, for placing phone calls, email addresses. You can even incorporate your handheld pagers as well. So along the lines of making sure that we have the ability to communicate with our staff across multiple delivery methods, we also want to make sure that we can reach out to them during the right times and make sure that we reach out to all the people who need to receive information about this particular incident. So we have to make sure we can reach out to not only our employees and our contractors, but also the individuals receiving care, the patients, as well as the families. And we have to be able to notify people before, during, and after an emergency as well. So this is actually a two-part answer here. So the incident phases. So for those of you guys who have incidents, I'm sure you're aware of this already, but we have multiple phases that we can use to deliver different information within one incident. So you can send out a new phase incident when an incident is starting. You can send out periodic updates as well as a closed broadcast as well. And they can be pre-built to allow for different information in those different phases. So if we take a look back in the system here, we can take a look back at that incident that we just launched before. So here's our active shooter. It is currently an open incident. So if we click into this incident, what we can do is right over here, we can send out an update. So if I click send update here, it's going to bring me back to that form, that incident form. And as you can see, we have that same variable before for the location. It's already preset with what we had used last time. And it gives us a separate box here for the update details. Now in this case, let's say that the shooter is still at large. So shooter is still at large, updates to follow. So we fill out the form and we can click next. And as you can see, the message here is going to be different than it was last time. Not only that, it's going to include the same update details that we just entered in a second ago. And in this case, it ends with a question of, are you okay? Because this update here is going to be a polling notification. So we can actually use this to help elicit particular responses from our contacts, asking, are people okay, or do they need help? Yet again, just as before, the contacts are preset, the settings are preset, so we can go ahead and just click send, and this information is going to be off and running. Now, let's say that the police apprehended this particular shooter. We want to close this incident out, let everyone know that this is okay. So what we can do is we can click close incident, send it with or without a notification. In this case, we want to send it with a notification. So yes, I'm sure I want to close this incident. Yet again, it's bringing us back to that form that we've seen. The ambulance entrance is still populated here. And we can click next. We can go right through the screen. Yes, it's okay that we didn't change any of the values. And yet again, different set of information saying that the active shooter has been resolved. So we can go ahead and send this out. And now this incident has been closed. The other thing I wanted to mention about this is, as you can tell, I'm currently logged into the system as an organization admin. We do have a separate incident operator role that will be able to send off these incidents the exact same way, and they'll be able to send off the incidents that you give them access to, not necessarily all of them. So, back to the slideshow. So that's how we can talk to people before, during, and after an emergency. The second part of that is the individuals that we need to contact. So our staff, and then their families, and individuals receiving care. So the staff are pretty easy. We're used to that. That's what we're uploading currently. So a lot of our hospital clients and healthcare clients tend to use an automated SFTP upload. Remember for this process of scheduling a job to extract data from your system of record, your HR system, modifying it into the Everbridge upload format, and uploading it into Everbridge, all done automatically once it's been scheduled. There's usually a good question that we receive of how often do we need to upload this information, and that just depends on the size of your facility, the amount of turnover that you guys have staff-wise. More turnover, the more often you want to update your information. We usually recommend either daily or weekly. When it comes to the families and the individuals receiving care, you don't necessarily need to keep track of their contact information the same way as our employees and contractors. So what we can do is we can actually use keyword groups in order to help us out with this. You guys are able to build these keywords that we can have in the Everbridge system so that your patients and their families can text that keyword to 33311 and automatically sign up to receive your broadcasts. The keywords can be set in a number of different ways, however you would really like them to be built. We've seen a lot of organizations use it for different facilities that they have, different campuses, buildings, things like that. So if we jump back into the system here, and we take a look at the settings that we have, we come to our publishing options and our Nixle groups. You'll see that we can go through and actually build out these Nixle group names ourselves. So I have one here for our main facility, north facility, and outpatient facility. The opt-in keywords are EV, GH, main, north, and outpat. So if we go ahead and text these to 33311, sign up to receive any broadcasts that are published to those particular events. In order to do that, we come to our notifications, click New Notification, and then down here where it says Publishing Options, click Nixle Channels, and right here you can type in the message that you need to deliver and send it out to any of these different event groups down here, either the main, north, outpatient, all of them, some of them, whatever it is that you need. So it's very easy to upload that information for our staff and our contractors from an HR system. We still have a way for you guys to deliver the messages to the patients and the families as well. So we're moving on to our next polling question now.
Hey everyone, do you have a way to interact with authorities in your local community during an incident? Here's the question, yes or no. Not expecting a lot of no's to come in. It looks like most of you are voting very quickly this time. Yes, it's clearly in the lead, but we do actually have a few no's. I'll give you a few more seconds to get your final results in. Okay, and the verdict that we have, I'll go ahead and share those results, is that 88% said yes, they do have a way to communicate, and we do have the 12% that don't currently have a way to communicate.
That's good. That's what I like to see. I'm glad that we have so many of you guys who are complying with these CMS guidelines already. So where we're going with this is we need to make sure that you guys have the ability to communicate not only with the people that we've talked about so far, you also might have to communicate with emergency providers within your area, right? It could be local or state emergency providers, things like public health, emergency management, EMS, police and fire, even things like the other healthcare organizations around you as well. And I'm going to go on a limb and assume a lot of you guys are currently doing this already, but the easiest way for us to build all of those people into the system is to actually go ahead and do it manually. So I know that we just talked about the automated uploads, right? How those are going to contain all of the staff and contractors that you guys currently have. But the thing is, if we build out those people from external agencies manually and give them a separate record type, then they won't be affected at all by our uploads. So we're going to take a look at that here in the system as well. We'll first come over to our Settings tab. Take a look at Contacts and Groups and Contact Record Types. So as you can see here, we have our hospital employee record type, which is the one that we're going to be uploading via the SFTP for all of our staff and our contractors. Then we have these other 4 record types down here. And so those ones are going to be all the different record types that we have manually controlled in the system. Let's take a look at our contacts. So you'll see here that we have a lot of different record types of hospital employee. For all of those contacts, they have been last modified by the SFTP. Like I said, they're going to be coming in automatically on that nightly or weekly basis. But for everyone else, anyone who has their partners or state contacts, record types, they're going to be last modified by an individual because they're going to be kept outside of that upload. So that's where their information is going to be coming from. It's all going to be kept manually. So it won't be affected in any capacity by those uploads, which means we'll be able to keep them in the system. You'll be able to message them as necessary. I believe we have another poll coming up here as well.
So for your next poll, everyone, if you have a way for staff and contractors, must be both, respond to you during an incident. You have a way for some staff, all staff and contractors, or none. Okay, the votes are coming in, and looks like we have a pretty good dispersal of responses. Let me go ahead and just close out this poll, and let's go ahead and display this here on the screen for everyone to see. So it looks like staff and contractors and all staff were in the lead. We have very few folks that have none, and some have some staff.
And I believe there's a second poll for this one as well.
Quickly, we'll go right into, do you have a simple way to log and track incidents so that they may be used later on for certification or review purposes? To select one of the following, do you manually update during or after, or if you have automatic tracking already in place? Right now, actually, the results are very interesting in terms of that most of you are doing manual reports, but quite a few, you do actually have some automatic tracking in place. So I'll go ahead and give you 2 more seconds. So I'll go ahead and close out the poll. And I'm going to close that out. And out, here's the results. Came out actually 78% have do manual updates, and 22% have automatic tracking.
I'm very impressed by the number of you guys that have the automatic tracking. It's very impressive. And then on top of that, I'm glad to see that so many of you guys were able to have your staff and contractors respond to those polls. That is very, very important. There's another one of our CMS guidelines here, to be able to receive acknowledgement that your recipients have in fact read those broadcasts. That's going to be just for your contacts, right? Just the people that you guys are putting into the system, either via the upload or manually. Not as much with the patients and families who are going to be signing up through those event groups. But for everyone else, we want to make sure that we are able to track their results. They are able to keep calm and confirm all the messages that they do receive from you guys. So we actually have a couple of solutions already built into the Everbridge system to help you out with this. First one is to make sure that we have our confirmation turned on. So this is an Everbridge best practice that we do keep confirmation on, which allows our contacts to tell us they have in fact received and read the messages that we are sending out. So as long as we keep that turned on in the defaults, then by default, every notification that we send or template that we build will have that on already. Then after that, what we can do with that confirmation is go back into the reports for our broadcasts and view those ourselves. And so we want to make sure that we go back and check those results, make sure people are in fact confirming as they should. So we jump back to the system here again. First, we want to go into our settings, notifications, and default options. And right here, the third one down is confirmation requested. Like I said, we want to make sure this is set to yes. This way we will be able to have our contacts confirm receipt of the broadcast that they send out. This is, as I said, an Everbridge best practice as well as a CMS guideline here. So we do want to make sure that is set to yes. Then, if we want to actually take a look at the results of our broadcasts, what we can do is just click into the broadcast itself. So if we take a look at that instance that we just launched, so we'll go to our closed instance because we did in fact close this out. We'll take a look at the most recent active shooter that we have. So as you can see, we have our 3 different broadcasts that were part of this one incident. So if we take a look at the active shooter update, that second one that we sent out, the polling response, we can look at this graph right here and see who has in fact confirmed versus not confirmed this broadcast. Now, because this is a poll and we were trying to elicit particular responses from our contacts, what we were doing is we were able to see some people say, yes, they're okay. Some people said that they need help. So what we can do is we can actually respond to those people who need help right here from this one page. If we scroll down, we can see all this information right in front of us. So we can see that the individuals who have confirmed, they'll have that little green yes. The people like me who have not yet confirmed this notification. For anyone who has confirmed, we can see what method they used, what the delivery method value, or the confirmation method value was, when they confirmed, in this case, what their response was. The most interesting thing that we can do is we also compare this to the first attempt time, so we can see how long it took people to confirm receipt of the broadcast once it was sent out. So remember, this is one of the things that we do want to do. We want to make sure that we go back and can check the results of the broadcasts that we send out, so that way we know people have, in fact, confirmed our messages. I believe we have 2 more polling questions now.
Okay, so for our next poll, question number 7, when is the last time you did a tabletop drill? 6 months, 6 to 12 months, or over a year ago? Go ahead and vote now. Ooh, it's coming in very quickly, so it looks like most folks have done a drill in the past 6 months, which is great. I'm going to go ahead and close out that voting and take a look at these results. So it looks like 77% of you have done a tabletop in the last 6 months. But there are a quarter of you who haven't done one in 6 months to over a year. So question number 8 is going to be, so when is the last time you did an active drill? Same options here, past 6 months, 6 to 12 months, or more than a year ago. Again, those are coming in pretty quick. So I'm going to give you a few more seconds in order to get your results in. Okay, so go ahead and share this with all of you. That, again, 65% have done an active drill in the past 6 months, but we do have an even larger percentage of you that haven't done one in more than 6 months.
So I'm glad to see that so many of you guys are actually going through and keeping up with those drills. It is part of the new CMS requirements that we do, in fact, not only develop the program, but actually maintain this training and testing program of the emergency preparedness plan that you guys have. So I will say, one of the requirements that actually just recently came out, CMS sent out a letter back on March 24th that people have to participate in at least one full-scale community-based exercise and run one tabletop exercise as well. Now, they understand that not everyone will be able to participate in the full-scale community-based exercise. So if you're unable to do that, you have to make sure that you complete at least one individual individual exercise, and make sure that you guys are able to document why you were unable to participate in the full-scale community-based exercise. So the plans that we developed, we have to make sure that's part of the multi-year training and exercise program with MyTEP, and that is going to be HC compliant. And what we can recommend that you guys do is actually use the Everbridge system to help remind you guys when you need to have these trainings, how to conduct the trainings as well. So what you can do is set up recurring notifications in order to help with this process. These are notifications that we can set so that way they'll automatically launch either on a daily schedule, weekly, monthly, or yearly type of a recurring basis. And on top of that, we always recommend that you guys try to spread out who you're going to be sending these to, as opposed to overloading everybody all the time. So you can have different departments every few months are going to receive their piece of the training. So in order to do this, yet again, we'll take one last look here in the system. We'll come over to our notifications, and this time we'll click schedule. In this case, we already have a scheduled notification set here. So if we go ahead and edit this, you'll see that we have pre-built the message, which is a reminder that the test needs to happen. Right? That's really what it's here for. So it can already come in loaded with the individuals who need to receive this message, the settings and everything. But the important stuff is down here at the bottom. As opposed to creating a new notification to send it off now, we want to create a new notification and schedule it on a recurring basis. In this case, we're going to have this repeat monthly, every 1 month on the first of every month. We can also have that daily, weekly, or yearly as well. It's a great reminder to have these things come out with everything else that you guys need to do monthly anyway. Things like your bed tracking, things like pharmacy inventory, whatever else needs to happen on that monthly basis. And it also helps you guys meet some other requirements as well. Things like local agencies, ASPR requirements, TJC requirements, everything along those lines. So Just want to make sure you guys understand that we do have these recurring notifications available. This way you can just set it up once, and every month they'll be blasting out their reminders for you guys to have your training sessions. So we talked a lot through here about a lot of the gaps that we have from the CMS Emergency Preparedness Plan and how Everbridge can help out with those different gaps that we have. So what I want to do is lead you guys to some resources that we will have available for you going forward. First thing, as always, I'm sure you guys know, if you ever have any questions, don't hesitate to reach out to your account managers. They're going to be chock full of a whole bunch of information for you guys. Everything from new product offerings, where you can get information, everything that you guys might need. As I mentioned before, we have a lot of those templates already, and what we call those are the CMS templates that we have for you guys. They are available to you. And again, reach out to your account manager if you're curious about hearing more details on those. But those are all the templates that you saw here in the system today. The last thing I wanted to mention is we're going to be conducting a live tabletop drill webinar with Dr. Stephen Golden from MIT at 1:00 p.m. Eastern on April 18th. If you'd like to sign up for this, please reach out to your account manager. Thanks very much, everyone.
Okay, everyone. At this point, we're going to move on to our question and answer portion of the session. I'd like to go ahead and introduce Lisa and Jeremiah, who are both well-versed in CMS regulations and will be assisting with questions. Lisa, Jeremiah, say hi. Hello. Say hi.
I was waiting for my camera to show. Hi, everybody.
Okay, so we have a few questions that people have submitted prior to and during the webinar. Just a reminder to all the attendees out there, you can continue to submit your questions by typing it into the open text field and submitting the questions to all panelists. If we don't get to your question here on the webinar, we will follow up with you by email after the webinar. So I believe the first question that we have is, do we have a local county? Your local county has Everbridge. Can we use this system to meet CMS guidelines?
I'll take this one. So if your local county or city, whoever it is that you interact with, does have an Everbridge mass notification system, you would need to reach out to your local point of contact there to find out if they have on their contract for other local partners and organizations to use their system. So there's no one way to say yes or no across the board, but you should absolutely reach out to them to find out.
If I could add just a little bit on there, what we do recommend via the CMS Emergency Preparedness Guidelines is that you do need a way to contact all of your staff and contractors. Usually the local county contracts don't have enough contacts for you to do that. So it is something that you do need to check with your local county, but there's a good chance that you're going to need to buy additional licenses so that you can contact your people.
Okay, we've got another question here. CMS regulations say that I need to contact staff that are working in the building. How can I integrate scheduling into my communications? Lisa, Jeremiah?
I can talk scheduling, so hey, why not? Scheduling. No, Everbridge does have a scheduling feature within the actual mass notification suite. It is something that is available within the system itself, and what this would allow you to do is you can build out various calendars and shifts with your contacts that you need to be able to get a hold of. You can also allow your contacts, so the people within your organization, to manage their own calendar as well. They can change their availability. It works with the Contact Bridge app. You can set up notifications to trigger based off of those calendars. You can have group managers who manage those calendars. I'm running through an awful lot of features here, but my point is that Everbridge does have a very robust scheduling feature within the mass notification platform. If you do have access to it, you'd see it on the Contacts tab. There'd be a scheduling section. If you don't see it, then you can reach out to your account manager to talk about that.
Another product question, actually, Jeremiah. Someone has asked, is there an option to publish social media or a blog site?
There certainly is. So one of the features of Everbridge is actually called social media posting. It would allow you, and we can actually jump to Alex, who I believe has it in his system, but it would allow you to send your message directly to Facebook or Twitter. You can send it to multiple accounts if you want to. Additionally, through the use of an in-platform feature called web posting, you can take your message and send it to blogs, RSS feeds, web pages, any number of things based on a middleware that you would want to put together. So Alex, why don't you go over the social media?
Let's just follow up from where you were, Jeremiah. So if we come into settings and publishing options and social media, what you would have to do is sign in with a Twitter or Facebook account that, for Twitter, if you would just post to that particular Twitter feed. For Facebook, you have to be a manager of whatever the page is you would like to post to, or you can post to your own personal wall. Then when sending out a broadcast, you come in and click Notifications and New Notification. You click Social Media, and you can choose which accounts you would like to send this particular broadcast to, either the Twitter feeds that you have or the Facebook accounts that you have here as well.
Fantastic. Thanks for showing us that, Alex. Lisa, question for you. Does a real incident count as an active drill?
It does. According to the CMS Emergency Preparedness Guidelines, if you do have a real incident that happens in your hospital, that does cover you for that active drill requirement for the year. You do need to have 2 drills. They can either both be active, or one can be an active one and one can be a tabletop one, but that would cover you for one.
And a follow-up question from the web chat. Can the tabletop and the active drill be on the same topic?
Yes, it can. So, for instance, if you were preparing for a chemical spill, you could do a tabletop run-through of your chemical spill, and then, say, a month later or 2 months later, you could do an active drill for that. Jeremiah, would you have anything to add?
No, I mean, I think you pretty much summed it up there. I mean, it's really, you want to make sure that these are part of a multi-year training and exercise plan that you all have been working on implementing over the last few years, I'm sure. So really just using the Everbridge system to build, to constantly build off of what it is that you're training on, right? So Alex specifically showed you that you can use recurring notifications for regular communications drills, right? So those are the little ones, but they're sort of the ones that are sort of helping you test out your system. So just making sure that everything ties together, going from your regular communications drills into your tabletop exercises, eventually into a full-scale or a functional or full-scale exercise, having the one system to sort of coordinate all the communications is what you want to take advantage of this for.
Great. Okay, I think that we have a few more questions in the web chat that our team is responding to, so we'll get back to you by email. I think we're coming up on a quarter or so, and we do like to be respectful of your time. So just as a reminder real quick, if you exit from this webinar, you're going to receive a questionnaire that I would greatly appreciate you taking the time to fill out. It will ask you if you have any other questions and get some feedback, and also allow you to request a chat with your account manager if you needed to further discuss compliance and the gap analysis. So thank you all for a great session. Thank you to everyone here presenting and answering questions. And thank you to all of you for attending the webinar. If you missed any part of this, just look for an email in the coming days. It'll include the slides and the recording. And I hope you all have a great rest of your day.